My name is Stephanie Pike. I'm a predoctoral research fellow here at the Prevention Research Center for Healthy Neighborhoods. As part of my application process, I was really interested in studying health disparities. And so an opportunity came up where I could do research here under Dr. Darcy Friedman. So my research is primarily on the future of food in your neighborhood study, which takes a look at the introduction of a food hub into this kind of multi-vendor space geared towards improving health outcomes within a food desert community. We conceptualize a food desert as being more of a food swamp, so all these different vendors where people can get food, but the impacts on diet are, as we know, farther reaching than that. So including them in our conceptualization has been difficult. There are a cafe and a brewery as part of the hub, but there's also this farmer's market, and the farmer's market is meant to engage the community.
My name is Callie. I'm a graduate research assistant at the Prevention Research Center for Healthy Neighborhoods. The primary goal of this study is to look at how the changing food environment might impact the actual health of the community. We've partnered with the St. Clair Superior Development Corporation. So basically they have opened up this food hub, also known as Hub 55. Basically we want to see if the opening of this food hub, which has a healthy eating cafe, a farmer's market, which is where we are today, and also different social events, we want to see if that actually has an impact on the health of the community members. So we're looking at this neighborhood and then also at the South Side community in Columbus as a comparison neighborhood. It's similar to St. Clair Superior, but they're not going to receive a food hub, so we're hoping to see that there's more change in the dietary behaviors of the community members here when compared to the community members there.
So last year we went out and collected data from different types of food retail vendors, such as corner stores, convenience stores, gas stations, pharmacies, dollar stores, and pretty much anywhere you can get food, to kind of see if there's a ripple effect within this neighborhood where we're promoting healthier eating behaviors. During this project, data collection was intensely and it was rigorous. We went around to food stores that might otherwise not be comfortable with us being in these stores. So our research in these food retail stores focused on scoring these stores based on 13 different healthy food categories to determine not only what was available, the price of the food, the quality of the food, and the amount of advertising. So we found largely there's this overabundance of really kind of unhealthy options. For the community, we mapped it all out and found that within a quarter mile, the healthiest food item is a diet soda. For more than 80% of the community, their healthy food item is a can of green beans. And for a very small percentage have access to a whole grocery basket of food items. And if you think you're going into one of these retail stores, you're not going to look for the can of green beans on the shelf because it's buried in a sea of chips and sodas and snack cakes and all these other types of food items you wouldn't necessarily bypass to get yourself a dusty can of green beans.
My name is Brady. I'm the current AmeriCorps Vista member at St. Clair Superior Development Corporation. We started the St. Clair farm stand to kind of test to see what the demand was for fresh and local produce in this neighborhood. There aren't a lot of good sources of fresh, whole, local foods in the neighborhood. So we knew from the residents that they definitely wanted an open air market. So we kind of figured that a true farm market model wasn't going to work for this location, but to follow through with what the residents wanted, we kind of sort of came up with this farm stand sort of model. We were able to partner with a local small business that's minority and female owned, the Healthy Living Kitchen. What's cool about the Healthy Living Kitchen is that it's also made up of Rhonda Sharpley, who is a certified holistic health coach, and Yolanda Ramus, who is a certified professional chef. So what we're able to do is not only give neighborhood residents the opportunity to buy fresh vegetables that are being grown in their own neighborhood that they normally didn't have access to, but they also have a chance to learn why the product is health promoting and how to cook it as well.
Traditionally, a food desert is defined by people with lack of access to a grocery store, supermarket within a half mile. So for this project, we expanded the definition to more look at census blocks to get a more granular idea of what a food desert looks like, and as well incorporate more types of food retail. This is what we came up with when looking at the people living within a quarter mile of a store and those living within a half mile of the store. With a quarter mile, we see a little more heterogeneity. You have a lot of blocks that have access to only low scoring stores. But you also have this weird mix of stores that have low and medium. Again, a low and medium scoring store means that the healthiest item that they have access to is a canned vegetable.